hello, and welcome, guys, to another edition of My Health Matters. Thank you so much for chiming in with us today. Today, we will be talking about a very, very, very sensitive topic. I chose this topic because this is the holidays, okay? And during the holidays, we want to enjoy our family. We want to enjoy the gifts. We just want to enjoy being around our friends, okay? But sometimes we kind of like slack on a few things, and by slacking on a few things, I mean our health. Okay, um, we run across a few um, unforeseen incidences. Was what I want to call it. Okay, unforeseen. And today we have a panel of guests today that we are going to talk about those unforeseen incidents. Right now, I want to introduce myself to those that do not know me. My name is Shay Brown Brown. I am the CEO and founder of SBB Fit for Life. I am a family nurse practitioner. I am a plant based nutritionist. I'm a certified personal trainer. I'm a medical cannabis provider, and I am an obesity management specialist. We have our next panel. This is Dr. Chidi Ikocha. I'm going to have him introduce himself to you guys, and we're going to keep moving down the panel.
Great. So I am Dr. TD Kocha, as Shay mentioned. I actually work in the emergency department. I am an emergency medicine doctor. I've been practicing as an attending doctor for the past 10 years. I do see a lot of cardiovascular disease, which we will be discussing today. So that's it.
All right. Thank you so much, Dr. Ikocha. And we also have Tiffany Henry. Tiffany Henry, can you please introduce yourself and tell everybody about your credentials tonight, please?
Yes, hello everyone. Thanks for joining. My name is Tiffany Henry. I am a registered nurse as well as a American Heart Association CPR instructor.
Okay, so tonight, again, like I said, is a very, very, very sensitive topic. We're going to talk about holiday scares. Okay, and before we came on the show tonight, I was talking to Dr. Ikocha and Tiffany about an incident when I was working in the emergency room. It was years ago. I remember there was a time where a lady brought her husband in. She was very, very upset. Explained to us that he was just got finished eating, like I think it was Christmas dinner. He sat in front of the TV, and I believe the Ravens was playing on TV, and he was yelling at the TV, going back and forth with the TV, and all of a sudden she heard him stop yelling. And she paused for a minute and it was like, what is going on? So she walked in there and he was unconscious. She didn't know what to do, so she called 911. The man had a heart attack. All right. So we don't want to say that the heart attack kind of like did him in, but he had a heart attack. And of course, we in the emergency room, we're working on him. They was working on him from the time 911 came in and brought him to the emergency room for some time. He was put on one of our stretchers. We began working on him as well. And we worked on him for a while. Unfortunately, this gentleman, he did not make it. And of course, that was something that was not anything that was pleasant, but these are things that do happen. And that came from, I want to say, a faulty diet, because the gentleman, he was overweight. Vasoconstriction, excitement from watching a football game. Those things can happen as well. He was on blood pressure medication. Okay, he was also a diabetic as well. So when you have that vasoconstriction means that your veins are tightening, your arteries are tightening up, and that means your pressure stays up. All right. When your pressure stays up, anything can happen. Heart attack, stroke. And I'm taking that's what happened with this gentleman that night. All right. I remember another incident, and this one, I mean, it just upsetted me to the core. It was Christmas Day. The young lady was 29. I don't know if anyone, Chidi, if you or Tiffany was in the emergency room, but I remember Dr. Beauvoir was the doctor that was there that day. And she was 29, African-American female, overweight, diabetes, and her brother was there. And she was unresponsive when they brought her into the emergency room. And I'm telling you, we worked on her for a long time, a long time. She didn't make it. And it was during shift change. We didn't care. You know, that time doesn't matter to us. We don't clock out. Shift change, it doesn't matter. We stay until we finish what we have to do. Okay. She didn't make it. She didn't make it. And I think what hurt me so much is that she was so young, so young. Diabetes, overweight, you know. And it was Christmas Day. Christmas Day. That wasn't a good Christmas day for me when I got home. I was happy to be with my family, but the one thing I remember, and I can still see myself walking down that back hall where radiology is at, walking out the door, I can hear the brothers scream so loud as they told him that his sister was dead. And tears just started running down my face. And I sat in my truck and I just cried because we really tried to save her, you know? So, right now, we're in the process of trying to save a life before you get there. That's why we are here. All right. So, we are going to talk to you guys about holiday scares. I just gave you two. All right. That troubled me. All right. So, please ask your questions. You have Dr. Yakocha here, and you also have a certified CPR instructor here to be able to talk to you guys about holiday scares. So, our first topic that we're going to talk about is heart attacks. All right. So, Dr. Yakocha, in your experience as a emergency room doctor,
Mhm.
uh, what are some of the risks of heart attacks?
Okay, that's a good question. So there are multiple risk factors for heart attacks or heart disease. Heart disease is usually it's characterized by excessive fatty deposits within the arteries that over time build up, where it actually obstructs or prevents blood from actually getting into the heart, and which could actually result in death of the heart actually. Certain risk factors, there are certain things that you're not going to control. So your age is one of it. So typically women starts at age 50, men at age 45. That's something obviously you're not going to be able to control. Your gender you're not going to control. Men tend to have a higher carry a higher risk of heart disease. Um, Family history is something else you're not also going to control. So if you had any family, really usually it's your parents or either siblings, they either had like a heart attack or diagnosed with heart disease prior to age 65, chances are that you may, you know, have inherited the same, fate. Now, it doesn't always hold true. It could also, there are other things that you can control, which may actually put your family members at a higher risk for heart disease. So the things that you can control. So those are the things you can't control, right? Your gender, your age, your family history. That's three things out of everything else.
Right.
Other things that you can control are your diet, your activity level, your weight, smoking, uh, blood pressure. It could either be inherited, right, or it could be also as a result of your lifestyle. Like
Mhm.
lifestyle decisions. Smoking can drive your blood pressure up. Bad just bad decisions can drive it up. So diabetes. Now diabetes can also be something that's inherited or you were born with, or it could something that over time it catches up with you because of poor diet and excessive weight gain, which then will make you diabetic as you get older. So basically, the risk factors, we'll point it out just to make things simple, just to simplify things. Your age, gender, family history, smoking, high blood pressure, high cholesterol, diabetes, inactivity, obesity. It's 9 things that I've mentioned.
So when you mention, and we have a question on our slide here, but I just want to talk about one thing. When you say um, fat deposits,
Mhm.
Is that something that you get at the grocery store and then you just fat deposit it? But what do you mean by fat deposit? Can you just elaborate on that word just a little bit? Just
So
for
I mean, yeah, usually it's from diet, and so it's usually cholesterol. That makes it up. That makes up those deposits. So over time, your cholesterol will build up in your vessels, and their cholesterol is very sticky, and it can stick into like the walls of your arteries.
Mhm,
And if you consume excessive amounts of cholesterol, usually the bad cholesterol, usually from animal fats,
mhm,
saturated fats, can lead to that. They will then adhere to each other. The plaque that stuck will then another one floating by, it gets stuck to it, and then it gets
mhm.
bigger, bigger, bigger over time, and all till there's and as it gets bigger, the heart itself, the blood flow to the heart especially if it occurs in the blood vessels that supply blood flow to the heart,
Mhm.
start to have limited blood flow. Over time, you may not have any blood flow. People start to exhibit symptoms typically, classically on exertion. So when you exert yourself, when you try to walk, run, and you need more blood flow to your heart, to your muscles, the blood is not able to get to that heart. So you start to have symptoms, whether
Mhm.
you start getting fatigued, you may get short of breath, you may actually start having chest pain because you're not getting the oxygen you need to your heart to finish or continue on with that activity.
So, Janine Cochran, she is one of my frequent viewers and with some of the best questions, I'm telling you. She has a question. Do women experience heart attacks different from men? And Miss Henry, I have a question for you because Dr. Ikocha just gave a lot of information. And I have a scenario for you based off everything that Dr. Ikocha just gave to us just now. So do you mind answering that question, sir? Dr. Ikocha?
Oh, so what? The question
Do
was for me. I'm
do
sorry.
women I'm sorry,
I,
do women experience
okay.
heart attacks different from men?
So women can have atypical symptoms. When I say atypical, they're not. They may not have a crushing or chest pain that you have in the center of your chest or off to the. Sorry, let me. Okay. Or off to like the left of your heart, of your chest, or
Mhm,
uh, a lot of times they may actually start exhibiting symptoms of like consistent with indigestion. Um, Actually, classically, like the first patient I ever diagnosed with as having a heart attack when I was a med student was a elderly lady, probably in her 70s, who had ate like some cereal.
mhm.
She felt like heartburn, and she took Tums. She took a whole bunch of like over the counter stuff. It didn't really help, so she decided, look, this is not getting better. So she came to the ER.
Mhm.
Her EKG showed signs of a heart attack, and we were able to confirm it on the blood work, and we, immediately we intervened. But the only symptom she had was indigestion, which is a lot of women would have that, or another symptom they may have without the chest pain is fatigue, just getting tired. Typically with activities they don't normally get, tired, fatigued with. If they walk into the kitchen, cooking or something like that, or exercising their normal exercise routine, they're not able to, perform it. That may be also like a sign of potential, like potential cardiac event. So
Mhm.
yeah, women can have um, symptoms much different than men do.
Right. Miss Henry, quick question for you. So, Dr. Kocha just gave us a lot of information just now on heart attacks. Okay.
Mhm.
Now, can people die from a heart attack?
They absolutely can. You can have a heart attack, like the doctor mentioned, and it cuts off blood flow to the heart, which there affects your breathing, and you can become unresponsive. And that's where CPR comes into place.
Okay.
If the community knows how to perform quality CPR, then you can absolutely save a life. So it's very important. And one thing I would like to add is even if you call 911, with the staffing shortages and everything we have in the world today, you need to react to your loved one or right there so they can have a better chance at living. If you are there to initiate CPR prior to EMS arriving to the scene. So it's very important because there is a lag time before EMS gets there, depending on where you are. My kids play sports, so sometimes these things happen in a field. And I've heard stories where, EMS has to get to the field, figure out where they need to go in order to be. So that can be a barrier in the lag time. So if people know how to do quality CPR, it will definitely save a life.
Okay, so um, thank you so much. That was a great explanation. Um, just a scenario. The family, they're at the dinner table, um, and Uncle Joe, everybody got an Uncle Joe, you know? Uncle
Mhm.
Joe's at the table and he's telling, oh my, got a little bit of heartburn. Girl, give me some more of that cornbread over there. Uncle Joe's at the table and he's getting it. And now everybody know Uncle Joe has high blood pressure. The medicine cabinet's full of pills right now. Okay? So Uncle Joe all of a sudden just stops eating. Okay? Uncle Joe falls on the floor. Scenario. Scenario. Of course, we would tell someone to call 911, but the whole entire house just went crazy. Should we just have just like a family meeting to say, hey, look, maybe we should just designate one person to maybe be in control of the situation, or just let whatever happen, or let the scene just let it play itself out? I mean, how would, because everybody's so excited, everybody's upset. I mean, how would you try to calm the situation and try and get
Well,
Uncle Joe? Because being that we're all so upset, we can't get anything done when, or save Uncle Joe's life when everybody is so upset. I mean, what are things that you can do to kind of like to help to save Uncle Joe a lot faster besides calling 911 and then starting the CPR? Don't, I mean, is there any type of maybe team effect that maybe the family might need to just talk about? These are things that it's okay to talk about. I mean, do
mhm.
you feel that's okay to talk about during like family holidays? I know I talk about that, with mine. My husband don't like talking, listening, but I'm like, honey, look, this is what's going on. And if he does not listen, my daughter Morgan, she knows what to do. What do you think about that?
I definitely think families should discuss it and talk about it. And again, the more that people know how to do CPR, the better, especially in a family and where you are. I've had experience where I had one of my girlfriends, and her daughter was choking actually. And she came up, we lived close to each other. And I never forget it. And I don't know if it was because I'm a nurse, so I'm able to zone things out and focus, because you have to be laser focused, especially when time is of the essence, and life is on the line. You have to be laser focused on what you need to do.
Mhm.
So that's how I am. I have to counsel the noise out and just go off of, let's focus on what I need to do. Because of course you don't want that, on your heart, on your mind, if you feel like you didn't put it all on the line. And so again, I think everyone should know how to do CPR in a family and be able to react. And if one person is better at leading the team, or be able to navigate and direct people where they need to go, like you called, you do this as a team effort, it would be a lot better.
Yeah, I agree with that as well. So, what are some of the steps to CPR? Because that is important. I mean, what are some of the steps to CPR?
Well, the steps to CPR is the acronym CAB. So they changed it. It's compression. So you're going to do them hard and fast. You're going to go at least 2 inches down. You're going to do at least 100. You're going to push down at least 100 to 120 minutes. You're going to tilt the head up to make sure air is able to get in, and you're going to make sure they're able to breathe. and you're going to focus on CPR and doing those compressions. You want to make sure the heart is pumping as fast as you can with your CPR. You want to
Mhm.
make sure arms are stiff and you're going dead center in the middle of the chest and pushing down, to make sure you get the most cardiac rebound as possible.
Okay. All right. All right. Now, I'm thinking you said 100 to 120? Girl,
Yes, weigh
somebody else
yourself.
in the house may have a heart attack.
Job. It is a lot, and even in a high setting, I know times, and they normally say do it and you can switch off. You do get
Okay, there we go.
you can switch off if you have someone else that can be able to render and help off. They normally say the average person can do it for like 2 minutes and then
Mhm. Mhm.
switch until EMS arrives.
Okay, all right. That sounds really good. Switching off, yeah, that sounds really, really, really good. Again, Ms. Cochran asks, how important is it to educate your family about CPR?
I think it's very important. I mentioned a lot of people, you have to wait until EMS arrives, and you don't know where you are, especially in faraway areas or rural areas. It takes a while to get to them. So being able to have the community know how to do quality CPR is very important, and it
Mhm.
can really save a life. So I definitely recommend it.
Okay. All right. So we have a comment here from Mr. Jethro Code Third. I would assign two people just in case that identified individual is the one going down. Okay. Well, that kind of makes sense too. I mean, just assigning people sounds like this is somebody that can take charge of a situation. So hopefully, in this family, they'll have their stuff together in case an unforeseen event was to happen. Miss Cochran mentioned that just doing chest compressions could break someone's ribs. How many inches did you say to go down?
2 inches, two
Just.
inches down. And breaking ribs it can happen. It's not
Mm-hmm.
uncommon. It's
Mm-hmm.
definitely common to happen. But
Mm-hmm.
would all love to have our loved one here with us, and we can worry about those ribs when they get to the ER with the with the ER. So definitely it can happen, especially with your elderly population and with fragile ribs. It definitely can happen or if not. So, but we want to make sure we do quality CPR as a priority.
Now, going back to Uncle Joe again, all right, and that piece of ham. Uncle Joe, he know he has heart failure. Now, a lot of people don't know what congestive heart failure is. Dr. Yekocha, Uncle Joe went back in the kitchen to go get some more ham. A ham sandwich with some mayonnaise and mustard, okay?
Mhm.
He went to go in the kitchen, he went in the refrigerator and got some beer, and the game was getting ready to come on. Now, as you see Uncle Joe going back to the living room, his feet starting to swell a little bit. Can you
Mhm.
talk to us a little bit about congestive heart failure? Because Uncle Joe about ready to go down.
All right. So congestive heart failure could be a result of actually multiple things, but it could be a result from a heart attack. So a heart attack is usually it occurs when you don't get enough blood flow to the heart, and if like the blood flow to the heart is if the blood flow over time is not getting to the heart for a prolonged period of time, it actually results in death of the specific area of the heart. So the
Mm-hmm.
muscle of the heart actually dies. So
Right.
the heart itself is just it's one big muscle. It contracts, to pump, squeeze blood and propel it and move it forward. With congestive heart failure, if you weaken the muscle, it doesn't contract as forcefully. So you have two halves. You have two halves of the heart. So you have the left side of the heart and you have the
Mm-hmm.
right side of the heart. The right side of the heart receives blood where the oxygen is used up. The blood that goes through the right side of the heart then makes its way into the lungs, where you then enrich it with oxygen. It then goes through blood vessels to then go to the left side of the heart, which
Mm-hmm.
then will then squeeze the blood into the arteries and into the systemic circulation to supply your brain. your heart, all your muscles, your eyes, with blood and oxygen.
Mhm.
So the reason why I state that is that heart failure could actually affect the left side of the heart, the right side of the heart,
Mhm.
or both.
Mhm.
And most commonly, it starts with the left, actually, because of um, usually if you have a heart attack, it tends to affect the left side of the heart. And then people who have poorly controlled high blood pressure, who have like poorly controlled blood pressure or
Mhm.
hypertension, where the vessels itself has a very increased tone to it. So
Mhm.
hypertension is when the tone of the actual vessel is very, very narrow. So
Mhm.
blood, you can imagine the heart kind of struggling to squeeze blood through a very narrow pathway. Over
Right.
over time, that could weaken the heart. So hypertension can cause weaken. Over time, the muscle does build up in the heart, but then over time, if the blood pressure is not taken care of, it will all of a sudden weaken the muscle of the heart. So that hypertension can lead to congestive heart failure. So congestive heart failure is a weakened muscle of the heart. A heart attack can cause congestive heart failure because you don't get any blood flow and it causes death. So,
Absolutely.
so when it affects the left side of the heart, if you overconsume sodium and you overwhelm and sodium, what it does is that it increases the tone of your blood vessels and it increases your blood pressure.
So
So
that has something to do with that ham that Uncle Joe had, right?
yeah, the ham did it. There was the
Ham
sodium.
has sodium in it?
Hmm? Has a
The,
lot of sodium.
not the ham. Come on, don't
The
tell me about.
ham, a lot of the foods we eat, a lot of anything processed, overly processed
Come on,
foods
man.
like
I can't have
uh,
any bacon either.
bacon. Yep.
Gee, what
And
about turkey bacon? Turkey bacon? Can I have?
it has sodium. It has sodium. It's better than the regular pork bacon.
Or does it have sodium in it?
It does. It
What
does.
about lunch meat? Can I get some lunch meat?
It has a lot of sodium. The deli meats, the lunch meats, canned
Oh,
foods.
come on. What am I going to eat then? Well, I mean, I
Lettuce.
want to live, but what am I going to eat?
No, I mean you could eat these things, but you have to eat it in moderation. And you have to have a balanced meal. You have to have other things too, right? You can eat these things, but you want to get your fiber. You want to get your
Right.
fruits. You want to get your veggies. You want to have a balanced meal. Everything you do, it's in moderation. I'm not saying to like totally avoid these foods. Now, if you want to avoid them, some people they do have to avoid them. Like if you already reached to the point where even eating a piece of ham could worsen, your condition, then you
Hmm.
avoid it, because who wants to end up in the emergency department, with me? So, um, so yeah, so basically, I mean, if you weaken the left side of the heart and the heart's not able to contract blood and move in a forward manner, it backs up into the lungs, and you can
Hmm.
flood the lungs with fluid, and
Hmm.
you'll start to have difficulty breathing, chest pain. If
Right.
you if it and over time it could affect the right side of the heart, and the right
Hmm.
side of the heart if it gets weak, the blood that it receives now it's not able to again move it forward into the lungs, so it backs up into the venous circulation, so you get swelling of your arms, your legs, and that's what you see with really bad congestive heart failure.
So, quick question for you. You talking about the left side of the heart, the right side of the heart. I mean, the heart is just one organ. Right, left. I mean, they're all just one organ. You're confusing me. So, my question to you, okay, right, left side, which one is worse? Right-sided heart failure or left-sided heart failure? Which one you think is worse?
um I would say the left because the left you get the lungs involved. You start to affect your breathing, your oxygenation, and over that. I mean, you can survive over a period of time with swelling in your extremities,
Hmm.
but you're not gonna make it with a whole bunch of fluid in your lungs, which
Right.
because if your oxygen is compromised, you're not gonna
Hmm.
get oxygen into the circulation into your heart,
Hmm.
and that will affect you. That's more deadly than the right side of heart failure.
Okay, so I hope everyone heard that. If you ever go to the emergency room or if you ever go to your doctor's office and they tell you that you have heart failure, you need to find out if you have left or right. Both of them are bad, but left-sided heart failure is worse.
Yeah. Or
I
you can
Yes,
have both too.
yes.
Yeah, yeah.
I knew what the answer was, but I wanted Dr. Kocha to really explain to you the difference in the two. All right, so we have another question from Ms. Cochran, and we have a lot of other comments and questions that I'm going to address as well. But then I'm going to come back to Mrs. Henry because I have another scenario for her as well. Okay. I have a friend who was born with a leaky valve in the heart. Can that be repaired with surgery?
Yes. I mean, it all depends. So you have four valves in the heart. You have two on the right side. You have two on the left side. Um, I mean, without going into too much detail, or yeah. So you have an aortic valve. You have a mitral valve. You have
Mm-hmm.
a pulmonic valve, and you have a
Mm-hmm.
tricuspid valve. They
Mm-hmm.
all allow blood to travel in one direction.
Mm-hmm.
When you say somebody's valve is leaky, it means that it's allowing blood to go backwards. So it's called regurgitation. So 84 of the valves can have that issue. Most commonly, you see it with the aortic valve and the
Mm-hmm.
mitral valve in the left side of the heart.
Right.
Um, and it could be something that you're born with. It could be something also that you acquire from a heart attack,
Right.
from heart disease, from poorly controlled blood pressure.
Mm-hmm.
Um, so those can affect over time, can affect those valves. So if it becomes leaky, that means blood can then go backwards and again cause the same issues um, that you see with heart failure.
Mm-hmm.
Um, and so those can be fixed depending on the severity. So they could be mild, which doesn't really need any surgical intervention at that point.
Mm-hmm.
But once you start to get to moderate or really severe regurgitation, it may require surgical intervention.
Okay. Miss Henry, going back to Uncle Joe. My Uncle Joe gonna get me. He really is. Going back to Uncle Joe. He back in that kitchen again. All right. He done had some ham. He done had his second helping of some turkey, some sweet potato pie. Now Uncle Joe, he done tried his hand at some fried chicken.
Mm-hmm.
Now Uncle Joe took his dentures out. All right. And he just didn't feel like wearing them anymore. Now Uncle Joe done got a big piece of chicken lodged in his throat now. Uncle Joe ain't talking no more. All right. He's sitting up here doing one of these numbers right here. He's not talking. Uncle Joe is choking. He
Mm-hmm.
doesn't know the thing to say, I'm choking. But we know Uncle Joe is choking. How can you tell when someone is choking? I mean, we know. But how can you tell when someone is choking? And what are some of the life-saving skills that you would recommend or even advise to others?
Sure, the universal choking is when someone goes like this, and this is how it looks like. So when Uncle Joe has that chicken and a piece of it is caught, and he may then become unresponsive or have
Mm-hmm.
breathing, then that's when CPR is going to come into play. You're going to make sure if you can see the item, you can try to get it. But if you can't, you're not going to just do a blind sweep and try to get it out. But you definitely want to initiate CPR, as well as, making sure he's able to, your head and neck tilt, to make sure he's able to get breathing, as well as telling a family member to call 911 to get EMS activated.
Okay, so Uncle Joe is not non-responsive, but Uncle Joe doesn't know. And I'm glad that you did this right here, because this right here is the signal to say, I'm choking.
Mm-hmm.
And that distress look, like, please help me. All right.
Oh.
Don't forget the look. But this is the sign that says, I'm choking. All right. Please educate your families. That's one way of saying, I'm choking without being able to talk, because when you're choking, you cannot talk. You are upset. Your anxiety level is sky high. You are trying to communicate. No one is understanding you. Why? Because you're all over the place. But I'm choking.
Mm-hmm.
Okay. So, Uncle Joe, my Uncle Joe really gonna kill me. Uncle Joe is not unconscious. He is responding. Okay. Now, do you still do CPR, Miss Henry?
You can do rescue breathing. So right here, I have these face shields. So if you can get the item out,
Mm-hmm.
help him with getting it out. It may help with his breathing. I would definitely still call EMS and activate 911.
Mhm.
But if you can get the item out, that's the best way.
Mhm.
The airway, so he's able to breathe a little bit better. But
Mhm.
I go get him medical attention.
Okay. All right, we have a question here for you, Dr. Ecocha, from Juanita May. Why does a person have to weigh themselves daily when diagnosed with CHF? I just got on here. I'm work really, Miss May. I'm working at John Hopkins. Can you answer the question, sir?
Of course. No, that's a good question. The reason why patients with congestive heart failure do weigh themselves daily is that um, it's basically it's a sign if they're having excessive weight gain, unexpected weight gain. It may be a sign of exacerbation of their heart failure. Like remember what I said? I said the right if the right side of the heart is affected, right, you have accumulation of fluid in your arms, your legs, in the vein, in the venous circulation. So if you're retaining fluid, you'll start to gain more weight, and so that means that your heart failure is getting worse.
Mhm.
So that means you need to come into the hospital right away to get medications that act as a diuretic to make you pee and get rid of the excessive fluids, and they'll have to investigate as to why your condition is getting worse. Now, it could be because maybe you're not taking your medications. It could be poor dieting, or it could be the heart itself is getting worse. So it needs to be worked up accordingly. So that's why.
Somebody's asking a question. Excessive fluid, water weight. What do you mean that? The question marks behind those words.
Okay.
Water
Water.
weight, excessive fluid. Can you elaborate on that a little bit more? And then we have another question.
Okay, so you retain the fluid, like so. Basically, if you're not taking the medications, a lot of medications you take with congestive heart failure, your heart itself is not doing a good job contracting very well, moving blood in a forward manner. So you need help. You need medications that will help get rid of the fluid that the heart is not able to um, push in a forward manner, and that kind of accumulates in your veins and in your circulation. Other things are that you need to get your blood pressure, controlled, so that the heart, it makes it easier for the heart to pump. Instead of a narrow blood vessel, it's now you want a bigger dilated blood vessel. It makes it easier for the left side of the heart to kind of push blood through. So the thing, the
Okay.
water, when I say water weight, is it's just that you retain the fluid, you don't get rid of it, and it allows you just to gain more weight. You're not peeing it out. It's just being and if it builds up in your veins, it starts to kind of go into like go through the veins actually, and into like underneath your skin. So you actually will see people's skin like pitting is what it's called, and you see actually
Puffiness.
swelling.
Yeah. Yeah.
You see
Swelling.
puffiness because the fluid is so much in the veins that now it's seeping through the veins and into the free space underneath your skin. So
Yeah.
these patients, they don't, again, it happens so quickly that they're not able to like urinate it a lot. They need help to get a lot of these, get rid of the fluids. And so when they retain these fluids, they it, they gain weight, and it's water weight actually. It's water weight because once you give them medications to diurese them. When I say diurese, it causes them to pee, urinate, get rid of all that fluid. You'll see a significant weight drop as a
Okay.
result.
I think Reverend Christian Johnson said he was responding to the question. I think what Miss Anita May said about the um, weighing herself every day. I guess just to see if you are retaining any fluid. Yeah, that's why you weigh yourself every day, just to see if you're retaining fluid. So we're going back to that choking question topic, Mrs. Henry. Mrs. Cochran, she's full of questions on every show, always full of questions. If a person is larger than you, how would you help them stop choking?
You can put your arms around them as much as possible, or you can get an help. If you have help or another person you can both wrap your arms around them to the Heimlich maneuver, where you would try to get the item out of their mouth. So that's what we would do, whether they were a large obese or if they were pregnant, we would go right above the belly, but we would definitely lock arms and go around to do the Heimlich maneuver.
I saw something, and I don't know if this is something that is still recommended. I mean, you're the you study this stuff more than I do, Tiffany. Um, I've seen to where people might push someone up against the wall and maybe try to Heimlich them against the wall. Is that still something that's possible?
It's possible. You can definitely still do that. If you don't have any other options, that's something you definitely can do.
Miss Juanita May said they can also lean over a chair. Now, how is that even possible?
Yes, you can lean over a chair to help yourself. If you by yourself and you feel yourself choking, you
Hmm.
over a chair and use the back of the chair to help facilitate getting that item out. So that is another way you can do, if especially if you're alone or if you do need assistance uh,
Hmm.
in helping get the item out.
Okay. All right. So is using a chair? Yes, it is. It still is an option, Miss May. It still is an option. So, Dr. E Coach is still moving on because we're still talking about the holiday scares. Okay. We talked about heart attacks. We talked about congestive heart failure. All right. Um, be fast.
Mm-hmm.
I think we were talking about that earlier. Strokes.
Mm-hmm.
Are those something, or is that still a thing that happened during I mean, I know it's still a thing, but can you talk to us about strokes? I mean, what exactly is it? We know what a heart attack is, but try to just explain to us what a stroke is.
Okay. So, I mean, a stroke is a similar to a heart attack. It's just that it's in the brain. So you have the same risk factors you do as heart disease, like smoking, obesity, hypertension, diabetes, and so forth. So basically, you have cholesterol plaque buildup that make its way into the arteries of the brain, and if they get large enough, they prevent blood from getting to certain areas of the brain, which can manifest as symptoms that depend on what side, which what part of the brain is affected. It could affect your cognition, your thinking, your muscles of your face. It can cause a droop. It can affect your speech. It could affect your extremities and cause weakness in your arms and legs, or sensory deficits where you can't feel things.
Hmm.
So basically, depending on what area of the brain is affected, you'll start to exhibit those symptoms. So basically, it's basically the same thing that happens to your heart can happen to your brain, and it's the same exact risk factors that you have for heart disease you have for stroke. So.
So I remember working in the emergency room, and there's this thing we call the TPA. We're not even going to get into all of that.
Hmm.
But I knew that once they got them there to that emergency room, can we give them TPA? And that was the thing that we knew that would help to break up the clot. Or what if they had a clot? We had to make sure that we did a CT scan to make sure that it wasn't a bleed. And if it wasn't a bleed, and if it was a clot, is it appropriate to give TPA? Now, I thought it was 3 hours that we had to TPI. Thanks, Juanita. You can tell I haven't been in the emergency room in a while. Um, I thought it was 3 hours that they had to get them to the emergency room if they were having a stroke. What is the recommended time now? Because I mean, I'm not in the hospitals anymore.
I mean, the recommended time is as early as possible. And
Absolutely.
once you recognize the symptoms, it's very time sensitive. Same thing with the heart. You want to, if anybody's exhibiting, all right, we'll go back. I'll come back to the stroke. But with a heart attack, it's important to recognize it because the faster they get into the ER, the faster you're able to salvage the heart. So the fact that they come to the ER, we evaluate the patient. If it's determined that they have an acute heart attack, you take them to something called a cardiac cath lab, where they actually go through either the artery, your radial artery in the wrist, or your femoral artery in your thigh, inject a dye to see if there's any blockages that needs intervention, whether you need stents or even bypass. So the earlier you're able to get to that, then you could avoid damage, like permanent damage of the heart. Same thing
Hmm.
in your brain. So it's very time sensitive. If you recognize any signs of a stroke, so what are those signs? There's an acronym, called B fast. So the B is for balance. So if you've noticed somebody's like not walking straight, they're persistently dizzy, they just look wobbly, that could be a sign of a stroke. E is eyes. So any blurred vision, any loss of vision, any double vision, anything concerning with your vision could be a sign of a stroke. The F uh, is your face. So if facial droop, any if you notice that, that could be a sign of a stroke. Um, the A, it stands for arms, but and so any weakness or any sensory deficits in your arms or even your legs, that could be a sign of a stroke. The S is for speech. Any difficulty getting your words out, any slurred speech, that could be a sign of a stroke. Most importantly is T, time. So you have to get that. You have to be able to recognize these symptoms and get the patient. You could, I mean, if you think it's quicker for you to drive, then fine. But 911, they need to be evaluated because TPA can be administered to them. You do have 4.5 hours, but you want to get it as close as possible to the time when the symptoms occurred. The longer you wait, TPA, the side effects of TPA is it could cause a bleed. It's a clot buster, so it dissolves the clot, but it can cause bleeding. So the longer you wait outside of when the symptoms started, you have more of a increased risk of a bleed, which is why they want you to get closer to like when the symptoms started. You don't want to wait till like 4.5 hours later. So we're us ourselves, we're encouraged to try to get it within 30 minutes, actually.
Absolutely.
So that's the standard of care, is to try to get it within 30 minutes if possible.
Absolutely. So we have another question here from Emily Brown. What is the best way to bring up your sugar when it gets extremely low? And what causes a sudden drop in your blood sugar? Now, make sure you differentiate extremely low, because I don't think people really understand what normal blood sugars are.
Right.
I mean, they'll tell me, girl, that's normal. My blood sugar has always been 170. 200? Girl, that's good. It was 350 yesterday. Girl, that's a normal blood. Please, Dr. Coach, please say what a normal blood sugar is. The normal blood sugar for every ethnicity. It doesn't matter if you're Black, okay? It's the same.
Yeah. So basically, I mean, your normal blood sugar, at least in the hospital where I work at, is anything between 70 and 110 milligrams per deciliter. You don't have to worry about the units, but 70 to 110 is what you strive for. Mm-hmm. Now, everybody has a different tolerance. Anything less than 60 is considered low blood sugar. But for somebody like I've tested my blood sugar one time and it was like 30 and I was still functional. So it all depends on the person. Some people are symptomatic at like 65. It all depends on your age and other medical conditions. So if I guess the blood sugar is considered extremely low if the person has symptoms from it. Your symptoms are going to be, you're just incoherent, you're going to pass out, you're going to be tremulous, shaking, and so it's technically your sugar is low. If we do a finger stick, and it's 60 or less, or even 65, and you're having symptoms, that's low for you. That's low blood sugar. Mm-hmm. So the best thing to give a person who has low blood sugar is a candy bar, juice, something, if they're not alert enough to consume anything by mouth, and obviously you got to call 911. They have to, give them medications, inject sugar into their IV to bring up their blood sugar.
Okay. Thank you so much. We have Miss Cochran, but why does the face droop during a stroke?
Okay. So it doesn't always droop. Like I said, it depends on which part of the brain is affected. Mm-hmm. So the stroke occurs on a particular area of the brain that affects the muscles of your face. It's going to cause it to droop. You could have strokes that don't affect the muscles of the face and just affects your right arm, your left arm. It could just be your speech. It could be just your cognition, and everything else is fine. So strokes, it all comes in different flavors depending on which part of the brain is affected. So Yeah, that's the answer. That should be the answer to the question. So
So, Miss Henry and Dr. Kocha, I have a scenario question for you guys. So, we know that we're talking about the holiday scares,
Mm.
and arrhythmias is another one that I want to talk about. Arrhythmias. People can live with arrhythmias. I mean, well, not all of them, but there's this one that they can live with. It's called atrial fibrillation, right? People can live with them every day
mhm.
as long as you're taking your medications, yada, yada, yada. But say, for instance, that someone was to go into their AFib and, they start getting a little diaphoretic, start sweating, stomach upset. And, they say, I could feel my heart palpitations. They can feel it. I feel like my heart is beating really, really fast. You know, um, is there such a thing? I mean, have you ever heard of somebody like hitting someone in the chest and then the heart rate goes right back into like a normal sinus? Is that such a thing, Dr. Kocha?
Not with atrial fibrillation. I've
Right?
not with atrial fibrillation. With other arrhythmias, I've heard of it. Like was it a cardiac thump?
Yeah,
so
it's like a cardiac arrest. I was going to mention that to you as well, um, Miss Henry, as well about the cardiac thump. Is that something that's known in CPR?
Not for rhythm analysis. Typically, we rely on the AED. The
Hmm.
around in public places to do rhythm analysis, so and let the machine pretty much guide you into what the next steps are
Hmm.
there to get the patient to the emergency room. But
Right.
familiar with a cardiac thump in the community? No.
yeah, yeah,
All right.
yeah. The thump is usually Shay. You see it with other like you don't really you see it more with like ventricular like tachycardia, fibrillation. And with Tiffany, like you should actually just rely on like the pads. They'll tell you what the rhythm is, and
Hmm.
those rhythms are usually shockable rhythms. They'll tell you to
Hmm.
shock, so you don't
Hmm.
really need to try to do no thump.
Hmm.
And it may not even work. Like so,
Right.
yep. So you have
Yes.
yep.
So, say for instance that someone did go into, or they had like atrial fibrillation.
Sure.
All right, and they went into what we call rapid ventricular rate. AFib RVR is what our abbreviation is. I mean, who want to say all those words, So we're going to say AFib RVR, which means that you have AFib and it's over 100 beats per minute. Can you go into like a little bit of detail about that, Dr. Kocha, and the risks associated with that?
Okay. So atrial fibrillation is basically the heart itself. It has it's like a big it's like a big battery, I guess. Like it's a muscle, but it also kind of controls it coordinates its contractions. So it allows so I told you there's two halves, and then there's four chambers of the heart. So the top half of the heart, it it contracts, in synchronous, and then followed by the bottom half of the heart. So
Hmm.
that's where you hear that the when the top half of the heart contracts, the valves that make up that are within the top half of the top chambers, they open up
Hmm.
and let the blood into the lower half of the blood of the heart, and then the bottom half of the heart then contracts to let the blood flow through the valves uh, into the blood vessels. So the right side of the heart will make it will shoot blood from the vessels into the lungs. Left side of the heart will shoot blood into the vessels, the arteries, into the systemic circulation. So what happens is that you don't see that coordination with atrial fibrillation. It's some the wiring system of the heart becomes erratic, and what happens is that the top half of the heart just kind of beats erratically. It just kind of like almost like it's vibrating, and it's not there's no coordination with the top half and the bottom half of the heart. And so what happens is that the actual heart rate can be very very fast. It could be in the 200s, 200 beats per minute. Your normal pulse or normal heart rate is between 60 and 100 beats per minute. Uh, Patients typically start to feel it when it's over 130 beats per minute. They feel it as fast, rapid, and irregular because it's a very irregular, erratic rhythm. And what happens is that when the patient exerts themselves and the heart rate is already this high, they get fatigued very easily. They get very tired easily. Some of them may start to have chest pain just because it's beating so fast. And so if you had like, an Apple Watch, it might actually pick it up, which is really cool. It's a neat function.
Yeah.
A lot of these smart watches are doing those things, and a lot of patients recognize that and they'll come in right away.
Mm-hmm.
But yeah, and sometimes with the heart beating so fast, the heart is still able to move blood in a forward manner, but not as much. So your blood pressure may be actually low, and so you feel lightheaded when you stand up. You feel weak, and so so you'll have symptoms where like you're lightheaded, you're weak. You'll have heart palpitations. You may have chest pain. You may be sweaty because you're not getting enough blood flow to, to all your organs, including your brain, which is why you're lightheaded. So, and what we do when a patient presents in the ER is you want to control the rate. You don't want the rate beating that fast because it's just not sustainable. So you give them medications through intravenously through IV, which you establish and to try to slow the rate. And then eventually you will try to deal with the rhythm and try to get them out of atrial fibrillation if possible.
Okay, very good. Good information. We have another question from Ms. Cochran. She asks, is cardiac arrest the same as a heart attack?
Yes. Yeah. No, actually, no. Let me preface that. So a heart attack cardiac arrest is when the heart itself is just not beating. It's not, it's not functioning. It's not contracting. There's no blood flow. Heart attack, you're still able to get blood flow. It's just it's impaired. You can still intervene. So the patient still has a pulse. Cardiac arrest, they don't have any pulse. There's no heartbeat. But heart attack, you still have a heartbeat for now. But if you don't intervene right away, it can cause the person to go into a cardiac arrest.
All right. So Emily Brown, cardiologist, explained that one chamber of the heart skips and the bottom chamber tries to catch up. Is that what it is with AFib?
So I would say it involves really two chambers. Like usually it's the top half of the heart. So maybe it's like the two chambers. But yes, it's just the two chambers are just, it's not coordinated. So like normally, like I said, the first half of the heart, the atria. Atria is plural, or atrium is single. So atria, they'll contract, move blood down, then the ventricles will contract, move blood down. You don't see it, so that loved up, but you don't see that loved up anymore. Now it's just like lub. So it's just all over the place. But it's still like the atria is still able to get blood into the ventricles, and the ventricles are still able to get blood into the circulation. It's not that great because the heart itself is not it's not giving the heart atrial fibrillation. The heart is not filling up with blood the way it needs to, maximally before it propels it forward. So whatever blood it sees, it's just like, even if it's a drop of blood, it's just moving it right along, at a rapid, rate. But it's not sustainable. Like I said, you're not getting enough. It's not enough to sustain all your organs.
Geez, this was a lot of information that we went over tonight. And we do not have enough time to talk more about this. I told you this hour goes by so fast. But before we do go, I definitely want to talk about the CPR classes that Mrs. Henry is doing as well. So, Mrs. Henry, do you want to talk to them about your CPR classes that you're doing?
Yes, I am a mobile CPR instructor through the American Heart Association Aligned. So I do CPR classes at my office. I come to businesses, facilities to teach CPR. So if anyone out there needs me to come out to do CPR, I'll be happy to do so. I do have an Instagram, my business contact number, which is 443-650-8102. You can reach me send me an instant message, a DM, and I'll be happy to instruct anyone. I also do daycare providers that deal with pediatrics and children who need CPR as well to operate their businesses. So if anyone needs any support in that area, you can definitely reach out to me.
All right, so we have a few people that are interested in CPR. Um, very informative information that you gave. Also, we definitely want to do a few announcements here. Definitely want to give a shout out to JC3. JC3 is my marketing person. I'm definitely going to give some shout outs to him. Anything you guys see about Fit for Life, you can best believe moi is not doing it. No, I was smart. I got me somebody to market my stuff now. So my juices, my soups, anything that's advertised for SBB Fit for Life, Shea Brown Brown, it is all being done by JC3. So I have his information here. If anybody's looking for a marketing person, and I'm definitely encouraging people to take this guy up. That's why I want to have his information here to promote him and his business because he is very good at what he does. He just threw something together within like 30 minutes for me. I'm like, thank you, bro. Thank you. Makes my life a lot easier. And that's what we want our marketers to do. Make our jobs easier, right?
Mm-hmm.
Exactly. So we have this information here. I call him JC3 because that's what I call him, JC3. All right. So if anybody need a marketer, his information is down here at the bottom. Also, we will be walking with Miss Ernestine Shepherd this Saturday, November the 19th. Please let it be November the 19th, but it's this Saturday, okay? November the 19th at the Druid Hill Park at 7:30, okay? We will be walking for Veterans Day. We know Veterans Day is gone, but my Ernestine, she always walks every holiday for whatever holiday it is, and the holiday is for veterans. So if you are interested in walking with us this Saturday, please meet us at the Druid Hill Park near the tennis court and the basketball court. You can't miss us. We will be the group out there with all the Army clothes on, okay? Also, if anyone is interested in my services, okay, obesity management specialist, please, this is my information here at the bottom. I'm going to post, well, I'm trying to post it. I'm sorry. Fingers. Trying to post my information as well. My telephone number is here. There it is. Free consultations, 443-470-9140. Anyone interested in changing their lifestyle? That will be me. I'll be the person that you need to call. All right. And I think that is about it for our announcements. I'm going to leave Mrs. Henry information up here to be the last thing that is left on our screen. But if anyone have any last minute questions for Dr. E. Kocha, Ms. Henry, I think that was about it. Somebody definitely needs some CPR classes. But Mrs. Henry, her information is here on the screen. So please write down her business information, her telephone number. If you have an organization, churches, businesses, I don't care. Everyone needs to know how to do CPR. All right. You might be able to save somebody's life that you love. All right. So thank you all so much for attending our My Health Matters, especially before the holidays. We hope that this information was very informative and that you guys did learn a lot from the information that we did give to you. Dr. E. Kocha, thank you so much for taking out of your busy schedule. I know that you are so busy, sir, and it was hard trying to track you down. But I appreciate you, sir. I really do. Tiffany Henry, I really appreciate you with everything that has been going on with you these past few days. I am very surprised that you were able to do this show today.
Absolutely. I would not miss it. I love Shay, Dr. Soon to be Brown. So I love you and definitely. And I wanted to also mention I have hybrid. I know everyone's busy and have different schedules, so you can do part of your CPR in your own home or your own area of work, and then meet up with skills just to make sure you're able to meet my mannequins behind me and be able to show your skills so you can use it in the community.
All right. So that is the end of our show. Please chime into our show next week to where we will be talking about asthma and unhealthy weight. how the two correlate together. So if you know anyone that has asthma and they're walking around with an unhealthy weight, you definitely do not want to miss this segment of My Health Matters. All right. So, guys, thank you so much. Oh, not this Wednesday because we won't be on because it will be the day before Thanksgiving. So, no, I will not have the show, but on the following Wednesday, okay, guys, I think it's the 30th, we'll be back with asthma and unhealthy weight. So, God bless. Happy Thanksgiving. And, guys, please be safe. Thanks for chiming in. Bye bye.